This is Rick Pumill from Cross County Cardiology, and welcome to Whiteboard Wednesdays. A very common question asked of a physician, especially cardiologist, is how do sleep disorders affect the heart? Well, I happen to be fascinated with sleep apnea. I not only see a bunch of patients with sleep apnea, but I personally have pretty severe sleep apnea, and I wear a CPAP mask every night. So sleep apnea means that even though you may be sleeping well or sleeping for 8 hours, but you're having episodes where your respiratory rate is dropping and your oxygen levels are dropping, and that can cause different catecholamines to be released, such as adrenaline and all. And also it can cause irregular heart rhythms, and it has significant effect on the heart, causing heart failure, high blood pressure, atrial fibrillation. So when we see somebody with sleep disordered breathing and heart disease, we aggressively work up their sleep apnea by sending them to a sleep specialist, get them treated, because that definitely helps in terms of improving heart function and heart safety. 7% of major motor vehicle accidents are attributed to sleep apnea. ADD, anxiety, and depression have all been associated with sleep apnea. Issue of atrial fibrillation, or the irregular heart rhythm that we see as cardiologists, is often related to sleep apnea. And I can tell you that it's almost impossible to keep somebody in a normal rhythm despite all the medicines and techniques we have if somebody doesn't treat their underlying sleep apnea issue. So in summary, sleep disorders and heart disease are very closely linked, and you can't treat one without the other. So thank you for tuning in for a brief summary of sleep apnea and heart disease from Cross County Cardiology, Dr. Rick Pumill.